Dr. Daniel Sulmasy of the University of Chicago is the speaker for the 15th Annual Flanigan Lecture. Dr. Sulmasy, your talk tonight focuses on conscience and clinical care. You've said this is a popular debate formulated as a clash of wills. Could you explain that, please?
What I mean by that is that the way the media have taken it up and the way some political groups have taken it up, it seems as if these sorts of conscientious objections are cast as one person asserting his or her rights, the physician or nurse or pharmacist asserting his or her rights, and it reduces to a shouting match, perhaps a sound bite or two, and that what we really miss is serious reflection on what conscience is.
Is it misunderstood, or is it even damaged, I think is a word you use, because it has been reduced a bit to sound bites and put into the culture wars?
Yeah, I don't think we really fully appreciate what conscience is because it takes more than a soundbite to explain it. It's not a little bird sitting on your shoulder whispering to you the right thing to do in the secrets of the night. Conscience is really, in the end, a commitment that we all ought to have to fundamental moral values, to being moral persons, acting in accordance with our most fundamental moral values.
It seems we're hearing more and more about this tension between religion and medicine. There was a case in Minnesota, the mother of a 13-year-old boy didn't want to have cancer treatments. Are we hearing more about that? Is it becoming more commonplace?
I don't think that these sorts of issues are actually more common now. I think in the United States there's been a long history of various kinds of religious groups that have very particular commitments regarding healthcare, the Jehovah's Witnesses, Christian Science, people like that. Again, I think you're hearing more about it because of a politically charged nature of some of the questions that have come up and then some of the media attention that they get.
Is there a line, or should there be a line, between a medical professional's obligation and his or her religious faith?
I think, first of all, we ought to recognize that lots of people are motivated to be in healthcare to begin with by their own religious commitments, and we ought to encourage that. People who really are deeply committed to doing what's good for patients, even to facing some of their own self-interest in order to do what's right for patients. Certainly, there are times when people will disagree over what the right thing is to do, but I think we can typically work those things out within the setting of a good long-term doctor-patient relationship in an amicable way, agreeing to disagree. But we certainly don't want to have physicians proselytizing in the setting of the doctor-patient relationship. We don't ever want to have a physician making the care that they give to a patient dependent on a patient converting or anything of that nature.
The bottom line is that we want to be able to sustain a commitment to the patient, correct?
Yes, I think that I swore an oath, every other physician swore an oath to use our skills for the benefit of patients, keeping them from harm, and that conscience is part of what helps to keep us on that road, what keeps us committed to patients, even in those times when no one's looking, when I'm doing the billing at night and no one from the federal government is looking, when I'm trying to decide what the right thing is to do for a patient and whether I should invest in a certain company that might be a conflict of interest. I think it's the conscience of the physicians that ultimately we have to rely upon to keep those physicians faithful to their oaths and doing what's good for patients.
Dr. Daniel Sulmasy is with the University of Chicago and the 2009 speaker at the Flanigan Lecture in Kansas City. Dr. Sulmasy, thank you very much and best wishes in all of your endeavors.
Thank you.